USMLE. Step 3 places a strong emphasis on clinical reasoning and patient management, making it crucial to master the most high-yield topics. These include acute care protocols, chronic disease management, and evidence-based decision-making. Understanding the essential approaches to diagnosis and treatment will help you navigate complex scenarios commonly presented on the exam. By focusing on frequently tested management strategies, you can maximize your performance and ensure readiness for real-world clinical practice. When evaluating a patient with chest pain, it is crucial to first consider and rule out life-threatening conditions. These include myocardial infarction, pulmonary embolism, aortic dissection, tension pneumothorax, and esophageal rupture. Prompt identification of these serious causes can be life-saving, as they often require immediate intervention. A systematic approach helps ensure that critical diagnoses are not missed during the initial assessment. When a patient presents with chest pain, several immediate steps are crucial. An electrocardiogram, or ECG, should be performed within the first 10 minutes to assess for signs of a heart attack. Blood tests to check troponin levels help determine if there has been heart muscle damage. Administering aspirin can reduce blood clot formation, while oxygen is given if the patient is hypoxic. Nitroglycerin may also be provided as long as there are no contraindications. Acute coronary syndrome, or ACS, refers to a range of urgent heart conditions caused by reduced blood flow to the heart muscle. The main types include ST elevation myocardial infarction, or STEMI, non-ST elevation myocardial infarction, known as NSTEMI, and unstable angina. Each type presents with chest pain but differs in severity and the changes seen on an electrocardiogram. Core management steps involve rapid assessment, stabilizing the patient, relieving symptoms, and restoring blood flow to minimize heart damage. Early intervention is crucial to improve outcomes and reduce complications. The MONAB protocol outlines the initial management steps for all types of acute coronary syndrome. This approach includes administering morphine to relieve pain, oxygen if the patient is hypoxic, nitroglycerin to help reduce cardiac workload, and aspirin to inhibit platelet aggregation. A beta blocker is also introduced to decrease heart rate and myocardial oxygen demand. Together, these interventions aim to stabilize the patient and limit heart muscle damage during the critical early phase of treatment. In the management of ST elevation, myocardial infarction, immediate percutaneous coronary intervention, or PCI, is the preferred treatment. This procedure quickly restores blood flow to the affected area of the heart, minimizing damage. When PCI is not available within the recommended timeframe, thrombolytic therapy serves as an alternative option. Thrombolytics work by dissolving the clot responsible for the blockage. Timely intervention is crucial to improve outcomes and reduce complications. Pneumonia is classified based on where and how the infection is acquired. Community-acquired pneumonia develops outside of healthcare settings and is often caused by common bacteria or viruses. Hospital-acquired pneumonia, on the other hand, occurs at least 48 hours after admission to a healthcare facility and is typically associated with more resistant pathogens. Aspiration pneumonia results from inhaling food, liquid, or vomit into the lungs, frequently affecting individuals with swallowing difficulties. Recognizing these distinctions is crucial, as each type has different risk factors, causative organisms, and treatment approaches. Diagnosing pneumonia typically involves the use of a chest X-ray to detect infiltrates in the lungs, which are a key indicator of infection. Once pneumonia is confirmed, selecting the right antibiotic is crucial and depends on whether the patient is treated as an outpatient or requires hospitalization. Outpatients are often prescribed oral antibiotics that target common community-acquired pathogens. In more severe cases requiring inpatient care, broader spectrum or intravenous antibiotics may be necessary. Tailoring treatment to the patient's setting and risk factors helps ensure effective recovery and reduces complications. When evaluating a patient with pneumonia, it is important to identify red flags that indicate a more severe illness. The B65 score is a valuable tool used to assess the severity of pneumonia. This scoring system considers factors such as confusion, elevated blood urea nitrogen, respiratory rate, blood pressure, and age over 65. By calculating the CUR-BI65 score, clinicians can determine whether hospital admission is necessary and guide appropriate management. Prompt recognition of these warning signs helps ensure timely and effective treatment. Pulmonary embolism often presents with sudden shortness of breath, chest pain that may worsen with deep breaths, and a rapid heartbeat. These symptoms can appear abruptly and may be accompanied by coughing or even fainting in severe cases. Recognizing these warning signs is crucial, as prompt diagnosis can be life-saving. The diagnostic approach typically involves assessing risk factors, performing imaging studies like a CT pulmonary angiogram, and conducting blood tests such as D-dimer levels. Early identification and intervention are essential to improve outcomes for patients with this serious condition. When diagnosing pulmonary embolism, clinicians often start by assessing the patient's risk level. For those considered low risk, a D-dimer blood test can help rule out the condition due to its high sensitivity. However, if suspicion remains or the risk is higher, CT pulmonary angiography is regarded as the gold standard for confirming the diagnosis. Once pulmonary embolism is identified, prompt initiation of anticoagulation therapy is essential to prevent further clot formation and reduce the risk of complications. Stroke is a medical emergency that requires rapid assessment and intervention. There are two main types of stroke: ischemic, caused by a blockage in a blood vessel supplying the brain, and hemorrhagic, resulting from bleeding into or around the brain. Distinguishing between these types is crucial, as their treatments differ significantly. Immediate CT scanning is essential to identify the stroke type and guide appropriate therapy. Time-sensitive interventions, such as clot-busting medications for ischemic stroke, can greatly improve outcomes if administered promptly. In cases of ischemic stroke, timely intervention is critical. After confirming there is no bleeding in the brain using a CT scan, tissue plasminogen activator, or TPA, should be administered. This medication works best when given within 4.5 hours of symptom onset. Prompt treatment can help restore blood flow to the affected area of the brain and improve patient outcomes. In cases of hemorrhagic stroke, immediate attention to blood pressure control is crucial. Elevated blood pressure can worsen bleeding and increase the risk of further brain injury. Early neurosurgical consultation is also essential, as some patients may require surgical intervention to relieve pressure or remove accumulated blood. Coordinated care between medical and surgical teams can significantly improve outcomes for these patients. Sepsis is a life-threatening condition that arises when the body's response to infection leads to organ dysfunction. Early recognition and prompt intervention are crucial for improving outcomes. The high-yield 1-hour bundle for sepsis management includes measuring lactate levels, obtaining blood cultures before administering antibiotics, and starting broad-spectrum antibiotics as soon as possible. Additionally, rapid administration of intravenous fluids is recommended for patients with low blood pressure or elevated lactate. Close monitoring and reassessment help guide ongoing therapy and support organ function. Effective management of sepsis begins with the immediate administration of intravenous fluids to support blood pressure and organ perfusion. Broad-spectrum antibiotics should be started as soon as possible to target the underlying infection. Measuring lactate levels promptly is also crucial, as elevated lactate can indicate tissue hypoperfusion and guide further treatment decisions. Early and aggressive intervention greatly improves outcomes for patients with sepsis. In the hospital setting, managing diabetes requires a different approach than in outpatient care. Insulin is preferred over oral medications, as it allows for more precise control of blood glucose levels and can be adjusted quickly in response to changing patient needs. The recommended target glucose range for hospitalized patients is between 140 and 180 milligrams per deciliter. This range helps minimize the risks associated with both high and low blood sugar, supporting better overall outcomes during hospitalization. Sensitivity and specificity are key measures in evaluating diagnostic tests. Sensitivity refers to a test's ability to correctly identify those with the disease, while specificity measures how well it identifies those without the disease. Predictive values, such as positive and negative predictive values, indicate the likelihood that a test result reflects the true disease status. Importantly, these predictive values are influenced by the prevalence of the disease in the population being tested. As prevalence changes, the probability that a positive or negative result is accurate also shifts. When working through CCS case simulations, it's important to start with the basics. Always remember to order vital signs and establish intravenous access for your patient. If the situation calls for it, provide supplemental oxygen promptly. Initiating empiric treatment early can make a significant difference in patient outcomes. These initial steps help ensure patient stability while you gather more information and refine your management plan. In summary, focusing on high-yield topics such as acute management of emergencies, diagnostic reasoning, and evidence-based treatment protocols is essential for success on the USMLE Step 3 clinical scenarios. Prioritizing patient safety, efficient time management, and clear documentation can significantly enhance your performance. Regular practice with case simulations helps reinforce clinical decision-making skills. By integrating these strategies, you can approach the exam with greater confidence and increase your chances of achieving a strong result.